Hey guys, Dr. Segel here. So most of the guys that we do prostate biopsies on are less than thrilled when we tell them that we're going to do the biopsy through the rectum. Let's talk about kind of the anatomy down there, why we do the biopsy through the rectum. Question is my urologist a magician? How are they going to do a prostate biopsy through the rectum? So let's talk about it. And in the end, we'll talk about kind of what I think is the most important thing to do before the prostate biopsy to protect you after the biopsy and make sure you don't have an issue, a complication, infection. Okay. So I think this is one of those questions where it's really important to look at the schematics. So this is the rectum right here. Okay. This big canal. This is your prostate. Let me circle it because it's not well seen on this one, so we're even colored in here. Now I made it a lot bigger than it actually is. But so when you look at how close the prostate is to the rectum, you can quickly see why we do the biopsy through the rectum. We put the probe in the rectum. I usually give some numbing medication, and then we take about 6 samples from either side of the prostate. But they're right next to each other. When we do an ultrasound of the prostate, it's amazing. I mean, we're talking about just a couple millimeters when you compress the rectum against the prostate. One of the other questions that we get when somebody understands that we do the biopsy through the rectum, one of the first questions we get is, well, doc, you're looking for prostate cancer, right? If you were to find prostate cancer and you've done a needle biopsy through the rectum into the prostate, isn't there going to be cancer that goes into the rectum? And the answer is we don't think so. All right, there's never been any tried and true studies that have proven that. It's the most common way that we do prostate biopsies in this country, and we do it that way because it tends to be the quickest. It tends to be the lowest learning curve, meaning that urologists in training can usually learn that the quickest. And we think about it as a safe technique in terms of prostate cancer screening. So no, we don't think about that as a likely scenario. This biopsy needle gun, it's goes into the prostate. It's carrying that prostate tissue, which we call a core. We call that a core of prostate tissue. It carries that core directly from the prostate into the body of that needle gun, and then we take it outside the body. So in theory, there's really no tissue from the prostate going into the rectum itself. Other biopsies that we do in the urinary tract can potentially carry that risk, but we don't think prostate biopsies carry that risk. One of the other reasons I like this schematic too is that, God forbid we found prostate cancer, we think we want to treat it, somebody's interested in a robotic prostatectomy or any prostatectomy. One of the questions that we had, one of the things that we counsel patients about is that when we do a robotic prostatectomy, we take the prostate out, there's always a chance of damage to the rectum. And I think this picture shows why this is a possibility. I mean, these structures are sitting millimeters apart. So when we take the prostate out, we're scooping underneath the prostate in between what we call the plane between the rectum and the prostate. So there exists the possibility of damage to the rectum for that reason. In fact, I think that it's pretty remarkable that it only happens like less than 1% of the time. So that schematic will explain why there's risk of damage to the rectum during a robotic prostatectomy or any prostatectomy, really. One of the other questions that we get, we diagnose somebody with prostate cancer, God forbid, they say they want a robotic prostatectomy, or they say they want an MRI of their prostate. We talk about the prospect of doing an MRI to better assess their burden of disease. Is there any disease outside the level of the prostate? Is there any bulge under the capsule of the prostate? All these things are reasons for doing an MRI. But the point I'm trying to make is that when we do this biopsy through the rectum, there is a ton of what we call inflammation that develops between the prostate and the rectum. That inflammation takes a while to go away. Usually when I diagnose somebody with prostate cancer and they're interested in a robotic prostatectomy, I talk to them about waiting 6 to 8 weeks because we want all that inflammation to get better for a couple reasons. First of all, we think that it decreases the chance of damage to the rectum during the surgery. Number two, I think it's provides kind of a better surgical outcome because it's easier to see the delineation between the prostate and surrounding structures because that inflammation is gone. There are circumstances where prostatectomies can be done sooner and there's not that degree of inflammation, but in general, we oftentimes will wait that long for that reason. In addition, one of the more common radiologic studies that we get to assess prostate cancer or to assess prostates in general is an MRI of the prostate. And individuals that get a biopsy are very eager to get this MRI as soon as possible because they want to know what the heck's going on with their prostate cancer, elevated PSA, etc. We, in general, discourage people from getting MRIs of the prostate before 6 to 8 weeks for very similar reasons. So forget about surgery. If we're just trying to get a picture of the prostate and there's all this inflammation between the rectum and the prostate, we're not going to get a good picture as to what's going on. One of the utilities, one of the reasons for a prostate MRI is to see if there's any cancer outside the edge of the prostate. And if there's inflammation around the prostate, it's very difficult to answer that question for radiologists. More than that, the prostate's a very vascular structure. It's got a lot of blood vessels in it. So when we do a prostate biopsy, there's going to be some blood that collects around the prostate, and that's another reason why the picture isn't quite as good unless we wait for a certain amount of time after the prostate biopsy to do the MRI. So those are reasons why we wait for usually 6 to 8 weeks, or oftentimes 6 to 8 weeks, to do the robotic prostatectomy or to do the MRI, just because both are higher quality if we can wait a little while. Doc, can't you just go right through the skin into the prostate to do the biopsy? So can you go from here, miss the rectum, and go straight into the prostate? The answer is yes, we can, but it's not commonly done for a few reasons. So it is a good technique because it's less of an infection risk, number one, but it's a bigger distance. So it is harder to get to the prostate unless you do a lot of these to do the biopsy. And so most urologists in training learn how to do it through the rectum because it's a much easier technique to get very good at. So we can do a biopsy straight through the skin. Certainly there are some people that have their rectum closed off for other surgical reasons, and then that exists as an option. But in general, we do it through the rectum because it's a technique that most urologists are more familiar with. If you decide to get the prostate biopsy and you're going down that road, I think this is the most important thing. The urinary tract in general is considered to be a sterile environment, okay? The GI tract, where the rectum is not a sterile environment. It's got a ton of bacteria in there. So one of the biggest risks with a prostate biopsy is a urinary tract infection, an infection in the bloodstream, something we call sepsis. So it is very important to take your antibiotics before and after the biopsy. It's important if you get a fever afterwards, go straight to the hospital. Some urologists have patients do antibiotics and enemas. That's great, and I think you should do the proper prep. The antibiotics are super important, probably the most or the more important thing, because when you do a biopsy through the rectum into the prostate, inevitably there's going to be some bacteria that get in the bloodstream because there's so many blood vessels in the prostate, and we want those antibiotics to be on board so that that infection tries to take hold. It can't, and those antibiotics will eradicate any existing infection. So that's the one thing that I want to tell you so that you have the highest chance of being successful after the prostate biopsy to not have any issues or complications per se. So that's kind of a description of how we do a prostate biopsy, why we do it through the rectum. Hopefully that gives you some information as to the details of it. Remember, this is something that takes 6 minutes. Most guys do just fine with it. That's it. Thank you so much for listening. Please subscribe to our channel.